All right, there are growing concerns healthcare workers are putting their lives at risk as they face a shortage of personal protective equipment such as masks, gloves and gowns. There's also been reports of some medical staff being forced to wear their own makeshift masks while some were making their own homemade sanitiser. President of the Nurses Professional Association of Queensland, Phill Tsingos, joins me now. Phill, thanks for joining us. Take us through the challenges that exist right now for nurses in this era of coronavirus.
Hi. Yes, well, the challenges are the nurses are concerned that they're putting their life at risk, that there's no masks, gowns or any goggles for them to protect themselves. They're also concerned that during this crisis, we've got an epidemic to look after, and also our registration body says, hey, if you do something wrong or not wear PPE correctly, your registration could be at risk. And then the third thing they're concerned about is if they're going to be caring for COVID-19 patients, will they have the adequate protection? Because a lot of nurses are saying to me, Phill, I'm prepared, I might lose my life over this, but I need to look after patients. And as a member of NPAQ, our role is to protect our nurses first.
Phill, there's also issues around shifts. I mean, these nurses are doing 12-hour shifts, some without toilet breaks, and they're being expected to go into the front line and deal with these particular cases. And we know it's only going to spike. We know it's only going to get more difficult. This must be incredibly frustrating for your members.
Our members are frustrated on many levels with not having toilet breaks. Like a lot of times we have a busy shift and yes, you don't get a toilet break for a long time, but if we keep these 12-hour shifts, they won't be able to eat or drink. They'll actually get sick. And when all our, like the Director General is saying, you've got to look after yourself, get plenty of sleep, get food and water and look after yourself, how can you on a 12.5-hour shift? They're also concerned that when they go and get into the cupboard to get the PPE, that it's all locked up for them. So they're concerned that they go to get PPE, there's nothing there. So there's a lot of problems. And we're hearing, all these stories from like the government, like the Queensland government and the chief nursing officer and everyone saying we've got enough PPE. And on the ground, they've got no PPE. There's nurses being told to write their name on a mask and put it in a brown paper bag and use that one mask all day. And that's equivalent to using toilet paper twice. It's not acceptable, and we aren't going to stand for it and let our members put their lives at risk. Unfortunately to say, we need to put nurses first because they're the ones that are on the front line looking after people.
And what about those that are most vulnerable, Phill? And I'm talking about nurses over 60, those who have, immune-compromised conditions, those who are pregnant, those with cancer histories or respiratory problems. Are they being expected to be working on patients who may have coronavirus? Well,
we've been asked by a lot of our members that are very concerned about that exact issue is I've had cancer and I'm on chemotherapy and I'm in the room next door to the fever clinic where 1,000 people are going to walk past. Am I going to get coronavirus? The problem is there's no leadership. There is no one giving any orders or direction of what they're to do. So they're coming to us and saying, Phill, can you show us some leadership? Because at the moment, the Queensland Government and Queensland Health are not showing any leadership to them. Our members' thoughts are they're expected to work with COVID-19 patients, put themselves and their families at risk of getting it. I had one member tell me the other day, his manager said, we know you're all going to get COVID-19. We just hope there's enough beds for you. Hope that you get it early enough so there's enough beds for you before they all run out. Now, that's not acceptable, and our nurses need to know that they're protected.
All right, President of the Nurses Professional Association of Queensland, Phill Tsingos, joined me just then. Thank you very much for joining us, Phill. Really appreciate it.